Hi, my name is Steve Threlkeld, and I'm an infectious disease physician in Memphis. And I was asked to make a few short videos about some of the concerns that people have that might be keeping them from going out and getting the COVID-19 vaccine. So I'd like to make a couple of comments in this video about pregnancy and any potential concerns about risks to pregnant women and to their unborn children. Right now, we're in the situation where only about 23% of pregnant women in America have received at least one vaccine even as of July 31st. And unfortunately, that sets us up for something of a storm warning where conditions are right for some really bad outcomes here. We have a couple of factors that are playing into that. Number one, it's just a much more contagious virus that's going to infect a lot more people who are pregnant this time than it did probably in the earlier rounds that we have faced with this infection. Secondly, as we mentioned, a lot of people have not been vaccinated in the population right now. And thirdly, that population of pregnant women is at substantially increased risk for bad outcomes, for hospitalizations, ICU stays, intubations, mechanical ventilation, and even death to mom and baby. So it really is a critical sort of situation. The American College of Obstetrics and Gynecology, the Society of Maternal and Fetal Medicine, and the CDC have all issued fairly strong recommendations to get the vaccine, no matter what stage you are in. If you're trying to get pregnant, if you're currently pregnant, or if you're breastfeeding thereafter. It's important to point out when people have these concerns, though we didn't start out in the vaccine trials including pregnant women, certainly quite a few people did get pregnant during the trial, and the only bad outcome that was noted in a pregnancy loss was actually in the control arm, a person that got placebo and not the vaccine. And in vaccinating well over 150 million people in society since, we have seen no increased risk whatsoever in the rate of miscarriages or other complications due to pregnancy or in overall pregnancy outcomes for the newborn. So it's shown, in fact, to be very safe and obviously very effective, we know from a lot of different studies, at preventing hospitalizations and death particularly. So it is a strong recommendation to get that vaccine no matter what stage of pregnancy you are in. I have certainly seen quite a few cases of pregnant women hospitalized, several being placed on the ventilator. We've had at least one death, not to mention a couple of people that have had some outcomes that are going to be real challenges to them with some disabilities that will really affect their ability to be an effective mom. So these are very critical issues to those of us who take care of pregnant women. I think one other thing that we have to be very careful about is that some pregnant women are falling prey to people who are appealing to their fears right now. And I think even some physicians are I think, giving very poor advice about pregnancy. And you have to ask yourself, if you have an obstetrician, for example, that recommends against the vaccine, you need to ask them the very serious and significant question of why their advice is diametrically opposed to the strong advice of both of the major governing bodies in their profession. So I think that's an important challenge that you really need to make. With respect to breastfeeding, we know that some studies show that we can actually take these antibodies that protect us against COVID-19 and effectively transfer them to our newborns. That will give some protection for the first weeks of life that can be so crucial. So it's a good idea in breastfeeding particularly to be able to transfer some of that protection to our new babies as well. Finally, I would just say that even as I was setting up the computer to do this, I got yet another call about a pregnant woman who was admitted to the hospital with pneumonia and some difficulties with the unborn child. So we would say, in the strongest of terms, I would certainly urge you to get vaccinated now if you are pregnant or trying to get pregnant. It is clearly the safest pathway to a safe outcome for both you and your newborn baby.